and welcome to the session 3 of the International Trade and Health Conference 2024. The topic for the session 3 is Revitalizing Trade in Health Services for Sustainable Development. This session, we will discuss the rise of trade in services, structural shifts in the world economy brought on by rapid technological developments, have placed services and services trade at the heart of economic transformation. Services account today for 50% of global trade in value-added terms, compared to 16% for agriculture and 34% for industry. As quoted above, trade in health services should be looked into detail. During the pandemic, services delivered through digital technology, such as cross-border health services and online technology transfer, became increasingly important. And we will discuss how trade in services can contribute to sustainable development. And lastly, we will discuss related research and development. To provide us with more details, may I please introduce the panelists and moderators of this session. Please welcome the moderator of this session, Dr. Matthias Helbo, World Health Organization, Geneva. Please welcome.
Good afternoon, everybody. Great to see already some people back, and I know it's not easy to have a session right after lunch, after such a wonderful lunch, but we have a very interesting topic to discuss. It's about trade in health services, and I'm not sure how familiar people are with trade in health services. Could you upload the first slide? Next slide. Is basically providing healthcare services to patients in Cambodia. Then they work together with hospitals in Singapore. They are exchanging information. For example, they send CT scans to Singapore, and this counts as so-called Mode 1 trade, and you will hear in a second from our colleague from the WTO more on that. This hospital, they treat local patients, but they also treat expats. They also treat patients that come from neighboring countries and who want to have a first-class service in terms of medical care. And the hospital employs, of course, local staff, but also temporarily we have medical doctors traveling from Singapore to Phnom Penh to treat patients in Phnom Penh. So I thought it's a nice example to illustrate how trade in health services plays an important role in providing health services in the region, and all these different modes are also often combined. And of course the question is then, what's the impact actually on the healthcare system? Can we make sure that trade in health services delivers in terms of having better access to health services for all? And this is the main question of today. It's how can trade in health services contribute to sustainable development? And with that, let me introduce the panel. We have, first of all, Jocelyn Magdelaine. He's a counselor in the Trade and Services Division, Trade in Services and Investment Division of the WTO. He's connected online, I hope. Jocelyn, can you hear us? I hope so. Very soon.
Everyone.
Great.
Can you hear me?
Yes, good to see you. Good morning.
Good afternoon.
So his sectoral responsibilities include health-related services and various business services. He's also responsible for the Service Integrated Trade Intelligence Portal database and the STRI, the Services Trade Restrictiveness Index. Before joining the Trade and Services Division, he was working on trade and services, statistics-related issues in the Economic Research and Statistics Division of the WTO, and before that on the same topic for the OECD. Next we have Rupa Chanda. Please, Rupa, you want to join us here on the panel? She's the Director of Trade, Investment and Innovation at UNESCAP here in Bangkok. Earlier, she worked as a professor of economics at the Indian Institute of Management in Bangalore and was an economist at the IMF in Washington, D.C. Her research interests include the WTO, international trade and services, regional integration, health services, and migration. So please, Rupa. Thank you. Just next to me, it's fine. Then we have the great pleasure to welcome Professor Kenji Shibuya, who is professor and chair of global health policy at the University of Tokyo's Graduate School of Medicine. He's also the president of Japan Institute for Global Health. And in 2001, he joined WHO's global program on evidence for health policy, and later became the chief of the health statistics and evidence unit at WHO. He has a very impressive list of publications on various public health topics, and he's also providing senior level advice on global health issues to the government of Japan. Then we have our colleague from the Thai government, Ms. Suchaya Prukbangrong, who is a trade officer in the Bureau of Trade in Services and Investment Negotiations. She's currently responsible for trade in services and digital negotiations, including with the EU and the Republic of Korea. She has extensive experience in international trade negotiations, particularly trade in services, for example, in the negotiations in the ASEAN Trade and Services Agreement. So welcome you all. It's great to have such a very prominent panel to discuss this topic. And we will start with a presentation by Jocelyn. Jocelyn is at the center when it comes to data on trade in services, and he will provide us with an overview of the most recent trends in trade and health services, but also about policies. Jocelyn, the floor is yours. You have about 12 minutes. Thank you very much.
Good afternoon. Can you hear me and see my screen?
Yes.
Great. Okay, so good afternoon. So first of all, sorry for not being able to be with you in person in Bangkok, but unfortunately I had other engagements here in Geneva, so I couldn't travel to be with you. But before I begin, just please allow me to indicate that the opinions that I will express in this panel are mine, and they do not purport to reflect the opinions or views of the WTO or its members. So with this, now I will begin this presentation. So I will explain what do we know about trade in health services. Now, first, let me begin by coming back on the examples that Matthias was providing a couple of minutes ago on what, I mean, I think we all have an idea of what are health services. I mean, we know that they're the services of medical professionals, of hospitals, nurses, and all sorts of other medical personnel. But then how can we actually define the trade in services? And this is basically driven by the way the GATT, the General Agreements on Trade and Services, which is the WTO multilateral agreement covering trade and services issues, defines the modes of supply. So how can services be internationally traded? So the most typical example that we have is mode one, cross-border supply, which is very similar to the concept of trading goods, where you only have the service that crosses the border. And as Matthias was pointing out, and this is something that we see is growing substantially in recent years, the most typical example is cross-border telehealth or cross-border telemedicine and all these other types of services that we have. Then we have mode two, consumption abroad. That's when the actual patient or a traveler goes abroad in the context of health-related issues to receive treatment while he is abroad. So that is mode two, consumption abroad. Then the GATS defines a third way of supplying services internationally, which is through commercial presence, which is basically defined as an investor in one economy. So we had this example from Singapore a few minutes ago, invests in another foreign jurisdiction to then produce and supply services in that jurisdiction. So it's a setup, an operation of foreign-owned hospitals, for example, or it could also be setting up telehealth companies, for example. Then last and not least, we have presence of natural persons, which is mode 4, which is basically about the movement of health professionals abroad to supply their services. So that's the movement of medical doctors, movement of nurses, movement of personnel essential to the functioning of these foreign-owned hospitals for mode 3. So all these pertaining to the movement of people to supply services. Now, one caveat, when we talk of trade in health services, we do not cover services supplied in the exercise of governmental authority. This basically means that any service provided by a public hospital, for example, a governmentally owned hospital, is not covered by the scope of service of trading services. So really here we're looking at private operators and commercial transactions in health services, which, I mean, of course, is probably not the bulk of health services out there, but it is something growing substantially because trade in health services can support the development of health public policy objectives. Now, how has trade in health services been growing in recent years? And well, trade in health services has grown very fast compared to traditional trading goods. Almost 5 to 6% per year since 2010. In comparison to trade in services, which is basically around 4%. So it's much more and much faster than traditional trading services and even trading goods. In 2019, and I'm stopping here at 2019 because I want to show you the figures before the pandemic. And the trade in health services reached almost $80 billion worth in 2019. But how has this picture, what does this picture look like when we look at individual modes of supply? And we see here that mode 3, so that's the establishment of commercial presence, represents the bulk of trade in health services, followed by mode 2, that's consumption abroad. So that means travelers going abroad to receive medical treatment. That's mode 2, 16%. And interestingly, that's been a mode of supply that has been growing substantially in recent years. We have mode 1, which is cross-border telehealth, which reached almost 6% in 2019. And finally, we have mode 4, which, although it's very important and essential, at the moment represents a relatively small value of trade in health services, representing approximately 4 to 5%. But what happened during the pandemic? There was a shift in the way services were traded. Because of lockdown measures and the border closures, mode 2 and mode 4, which implied the movement of people in the context of trade in health services, decreased substantially. Minus 58% for mode 2, that's consumption abroad, minus 39% for mode 4, that's the movement of health professionals, basically. So those two reduced substantially. And what we see, however, is that telehealth, cross-border telehealth, increased substantially by 14%, which is a huge increase in value terms just in 1 year. Now, let us look at what is trade in health related services. How important is it in 2022? So let me first focus, on the table at the bottom of this slide here. So we see here that the value of trade in health services has continued increasing substantially, growing up to over $90 billion by 2022. So that's 3 years after the pandemic. Remember, we were around 80, now we're up to 94 billion. Asia represents a substantial share of this trade, representing 10%. ASEAN represents $4 billion, so meaning that a large part of all this trade. And what we see then with the share is the percentage of exports and imports of trade in health services in total trade in services. So it still represents a relatively small share of total trade in services, but this is what is important to mention is this is growing. And who are the main actors in the region? So we see in particular that Singapore, Thailand, Malaysia and Philippines are major exporters of these services. And this we have seen for many years in different modes of supply, and I'll come to this in a minute, but they're also major importers. And even in other economies, I mean, for the moment, the share is still relatively small, but we'll see that there are some explanations to this. which in particular are related to certain barriers that are still in place, important barriers in place for trading services in many of the economies of the region, as well as many other economies around the world. So now let me move to the evolution of modes of supply in health-related services. Oh, I see that this is probably better. So I'm looking here at the trade in health services by modes of supply, which is derived from an experimental data set on modes of supply. It's very recent that we actually have data to play around with on modes of supply, and we actually have some data on health-related services. And we see how, if we go from top to the bottom of each column, we see how the breakdown of modes of supply has evolved over time in the world, in Asia and ASEAN. And what we see in the world is that although Mode 3 represented a very large share of trade in health services in 2005, 50%, this has increased substantially up to 2022. And we also see a similar pattern in Asia, which is something that is less prominent in ASEAN, where Mode 3 seems still today to represent a relatively small share of total trade in health services. Now, in terms of evolution, again, going from the top to the bottom of each column, what is interesting to see is the shift between modes of supply, in particular between Mode 2 and Mode 1. So the reduction of the orange part of the pie charts and the increase of the blue part in these pie charts. And we see today that cross-border telehealth in particular represents 9% of total trade in health services worldwide. In Asia, it represents 15%, and in ASEAN, in the ASEAN region, cross-border telehealth represents 51% of the total trade in health services. This is mainly driven by one country in the region, which is Singapore, where it seems that cross-border telehealth has been a way to supply service internationally increasingly used in recent years. Now, I mentioned trade in services barriers. Let me show you here data drawn from the WTO and World Bank Services Trade Policy Database, and in particular, the Services Trade Restrictions Index. And what we see here is that the darker the shade, the more restrictive policies are for trade in health-related services. So we see that overall, so the darker the red, the more restrictive economies are. And what we see here is that, well, trade in health-related services is quite restrictive. It's not dark red, of course, overall, but it is still quite a heavy shade of red. And if we focus a bit more on in Southeast Asia, we see that they are also rather restrictive in Southeast Asia, but it seems that policies are much more harmonized. They're all ranged in the range of 40 to 60 in the STRI, which means that policies are moderately restrictive. Now let me focus on this slide here. So again, I'm showing the STRI. So when I was mentioning shades of red in the previous slides, the maps, but now let me explain how the STRI is built. Basically, a value of 0 means there is no restrictive policies in place. A value of 100 means that the sector or mode of supply is basically closed. And what we see on this slide, for example, is that in Indonesia, Singapore, Thailand, so we're looking at import restrictions, of course, is that for Mode 1, the policies in place mean that for Mode 1, cross-border telehealth imports are simply not possible in economies such as Indonesia, Singapore, and Thailand, and meaning based on the regulatory environment. For Mode 2, the situation is really different. It's much more liberal, and that's not a surprise. Mode 2 policies have, in general, been always much more liberal. Mode 3 is moderately restrictive. We see that from the values of the STRI, and Mode 4 is quite restrictive, mostly driven by a number of policies relating to the qualifications of health professionals, but more strangely, the nationality of health professionals. So what are the main policies driving the STRI? So for Mode 1, basically the main barriers relate to the absence of health insurance portability and restrictions on cross-border data flows. And then I'm adding at the bottom of each box here some policies that we did find in certain economies, such as identifying when cross-border supply was prohibited, or when there were local presence requirements in order to be allowed to supply your services cross-border. For mode 2, again, health insurance portability is an issue in many economies, meaning there is no health insurance portability in existence. And also, again, cross-border data flow restrictions, which are also important for mode 2, because before you travel abroad for health treatment, you often also have to have teleconsultations with a medical practitioner, which you also need once you return home after your medical treatment. So those are also policies hindering trade in health services through mode 2. Mode 3 is mainly driven by horizontal policies, which are not linked to health services per se, but basically across the board policies such as screening of investments, so forbidding investment or authorization processes for investment, boards of restrictions, and restrictions on national employees. And then we also find a number of these other barriers that in certain economies at the bottom of this box. And finally, for mode 4, again, horizontal policies, visa requirements, labor market tests are important barriers to trade in health services through mode 4. That means for the movement of health professionals. Now, let me just conclude with with a couple of slides. If I still have 1 or 2 minutes, is that okay?
Yes.
Yes, okay. Of course, I've been highlighting the barriers to trade in health services, but there may be other issues that need to be tackled if we want to support more trade in health services in the future. And this concern issues pertaining to the establishment of good regulatory practices in health-related services, which may have an important bearing for cross-border telehealth in particular. We need to have good governance disciplines to enable transparent, predictable, and efficient practices, develop sound processes for recognition of foreign qualifications, which is key for mode 4, but it is also key for cross-border telehealth, because if you don't have sound processes to recognize foreign qualifications, that will hinder this cross-border supply of telehealth services. Then, of course, when it comes to telehealth, we have digital regulation, infrastructure issues and interoperability of platforms, because platforms play an important role in cross-border telehealth. Then we also have all these services important for health value chains. And then, of course, education and training necessary to develop skills in using telehealth. So all these policies are important to support the development of trade in health services. So beyond tackling trade barriers. So what would be the benefits of international trade in services discussions? Well, of course, to enhance the access and quality of services worldwide in health services, cost savings and efficiency gains, by binding applied policies, so by making commitments in international trade agreements, we can increase transparency and predictability for the actors in the sector. We could also have further discussions on liberalization of this sector, endorse good governance disciplines, facilitate mutual recognition agreements, increase health education and training, and address also, which are very important for telehealth services, liability issues and data flow questions. So let me close with this slide. I mean, most of the information I've been providing today is derived from a joint World Bank to WTO report, which is called Trade Therapy, Deepening Cooperation to Strengthen Pandemic Defenses. And in fact, this report includes an action plan of how to improve trade in services issues for health purposes, and includes an action plan, so a menu of options for governments to implement certain policies, and benefited, of course, this report from contributions from the people, from some of the participants in the panels, in particular RUPA, WHO, etc. And let me finish with this point. We soon have a coming report produced by WHO, WTO, World Bank, and Geneva Digital Health, which will tackle policy considerations when it comes to cross-border telehealth services, given the importance of this mode of supply for health services. Thank you very much for your attention, and looking forward to the discussion. Thank you.
Thank you so much, Jocelyn. It was a very fascinating presentation to see the latest trends in trade and health services, and I'm sure there are many questions from the audience. But before that, unless there are any technical specific questions, If not, I would move to Rupa. Yeah. Okay, one quick question here from the ambassador.
Yes, thank you very much for the presentation. I'm a former services negotiator. So I have one technical question. You mentioned a couple of times about the barrier in mode 1, which is the data flows. In my view, data flows restriction is not only applicable to health services, but it is a trend for data privacy protection, which is, the EU have the EU and every countries are doing the same. So okay, I recommend.
Okay.
I will be staying. I'm staying. So maybe we can have the other presentations and we can address these questions in a minute,
Fine.
in a few minutes.
Okay, thank you. Okay, so let's go over to Rupa. Rupa, she wants to use the rostrum. So Rupa and I, we have worked together on this topic of trade and health services for a while. We also published a book in 2017 on how to achieve a win-win between trade and sustainable development. And Rupa will present the latest insights, especially looking at policies. I think it's very important to look at policies, how to make trade work for public health. Over to you, Rupa.
It's just harder to juggle so many different one in this. Okay, so first of all, a very good afternoon to everyone, and thanks to WHO and Dr. Chaim for this invitation. I think it's good that Jocelyn has provided the context, because I can clip some of the slides. It's becoming a pattern. He starts and then I come in next, even at the WTO Public Forum. So what I'll be talking about is why trade and health services is relevant for sustainable development, providing that broad overview of the relationship, which is quite complex and multifaceted, and then looking at some of the channels through which this, the implications for sustainable development can arise. They can be positive, they can be negative too, depending on what we do, what are the conditions, and how we address some of the benefits or other things that naturally can accrue from trade. So this is just quickly the outline, motivating why this is an important topic to look at. How do we understand trade and health services? I won't repeat what Jocelyn has said, but I'd add a few points there. And then the implications, as I said, the various pathways through which health services trade can affect sustainable development. Give an example where some of the issues that have been thrown up in the literature on sustainable development and health services trade, how they are illustrated in a particular case, which is that of Thailand, and then some of the takeaways. So just to motivate the topic, why are we looking at this? Because directly or indirectly, health conditions and outcomes are linked to sustainable development. Of course, there's a particular SDG 3 which relates to health, but then there are many other pathways. If you look at things like, industry, innovation, and infrastructure, you look at job creation, poverty. A lot of this also depends on health as being part of the human capital investment that then gives rise to these other SDG outcomes. So therefore, health is both not just an outcome, the final effect of sustainable development, but it's also an input into the process of sustainable development. So on both ways, it's important. If we look at trade, the relationship with sustainable development is, I would say, more complex. Because the empirical evidence is quite mixed on it. Of course, trade provides you the means in terms of foreign exchange revenues, the innovation, the technology transfer that comes with it, etc., and it can benefit. But at the same time, it can widen inequality, it can make you much more exposed to global shocks, it can displace jobs. So ultimately, it's not specific to health. Trade in health, trade in any other area, it really depends on what the initial conditions are. How do you shape the benefits that can accrue from trade, and what sort of regulatory and policy environment you have? And so this same nexus holds in the context of trade and health services also. Now, why are we looking at health services? Because it's really like the backbone of health interventions. This has been mentioned in the morning by Ambassador as well. So when we're looking at issues of access, quality, standards, availability of human resources, well, health services are critical in this. And why trade in health services? Well, if you look broadly again, look at the way trade in services is growing much more rapidly than trade in goods. From less than $400 billion in 1980, today it's close to $8 trillion in 2023. More and more services are becoming tradable, including what are seen as the so-called social or public good services like education and healthcare. And services increasingly are being seen as an important intermediate input into the wider economy. So competitiveness-wise, improving access to basic sort of services, etc., the whole nexus between services, trade, and wider economic competitiveness, accessibility, jobs, etc. So I think people are understanding the role that services can play in the economy. Now, globalization of health services, as has been mentioned by Jocelyn, all the different channels are operating the various modes that he mentioned. You have cross-border investment flows. He mentioned about commercial presence being very significant. The mobility of health professionals and patients across borders. This, of course, you can put under professional services, but I'm taking a broader view of health services trade. Then the use of telehealth and other digital technologies. So ICT has promoted more tradability of health services. And again, taking a broader perspective, the transfer of knowledge, research, skills, know-how, etc. So increasingly, international trade in health services is creating a lot more possibilities to contribute to economic and social development. And we need to understand these channels. So that's what this presentation is really about. As I've already mentioned, you have SDG 3, but within that also, if you look at sub-indicators, SDG 3.8, like universal health coverage, financial risk protection, SDG 3.9C, which is about health financing, development and retention of personnel, etc. Trade in health services impinges upon these SDGs very clearly because it affects access, quality, affordability, availability of personnel, etc. But as I would like to say, the impact goes beyond SDG 3 or these specific sub-indicators. It can be much wider, and that's the sort of holistic perspective I'd like to take. I will not repeat this. Jocelyn has already mentioned about the 4 modes of delivery, and they're all pertinent. The only point I'd like to add here is that if we again go beyond just trade in health services, there are a lot of trade in ancillary services that actually also accompany trade in health services. So for instance, if you're talking of telemedicine or consumption abroad, then there's all the associated sort of back office related support services, health insurance, claims processing, etc., that would accompany. If you're talking of movement of personnel or commercial presence, well, there's a lot of complementarity across the modes. Many modes move together, like the example Matthias had given at the very beginning. And then, so therefore, things like medical education related and training related services and cross-border delivery of those could also have to accompany basic trade in health services. So there's a lot of other related services that do get traded with health services, and there's also trade in goods, which gets augmented as a result of trade in health services, drugs, diagnostics, etc. So if you have consumption abroad or you have commercial presence, you also need the equipment and the technologies, etc., to go along with it. Just to put things in perspective, as Jocelyn mentioned, it is a restrictive sector. However, one has to understand that this is a public good, it's a social service sort of sector, and issues of quality, standards, affordability, those obviously have overridden the commitments that were made. So if you look at the GATS commitments, health, education, and environment, education has the least, health next, and environment. These are the 3 least committed sectors, and understandably so. So only 39% of WTO member countries have made commitments in health services compared to, say, something which is traditionally a very commercially oriented sector, like tourism, 95%. And Jocelyn also mentioned the variety of regulations, Mode 1 restrictions like personal data transfer related requirements, insurance portability in the case of Mode 2. In Mode 3, there could be FDI regulations, there could be conditions put on foreign investors, and in Mode 4, which is extremely restrictive, immigration and labor market related regulations, recognition and licensing barriers. Now, the impact that you have of trade and health services on SDGs obviously then gets shaped by the regulatory and policy environment that you have. And again, I will not argue here that whether these are good or bad regulations, because they have a role to play. And it is important in a sector like health to have some of these regulations. Now let's look at the implications of trade and health services. I put potential against all of this because in the context of any kind of trade, yes, while we know trade is good, but it also is shaped, as I said, by the conditions that prevail. So not all countries may benefit necessarily in the way we think that trade helps countries. So export earnings, the sort of knowledge transfer and so on that accrue from trade don't have to necessarily benefit, because it's the capacity of the countries and the prevailing conditions that will intermediate those. So export earnings through cross-border telemedicine, medical tourism receipts, this is the classic way in which trade helps, potentially helps a country. These can contribute to increased financing for development. These can help increase the capacity in the health sector in terms of improving access to healthcare. And then there can be a whole variety of spillover benefits in terms of better infrastructure, standards, technology, etc. Now let me give examples through Mode 1, for instance. Mode 1 exports. So the investment that would go into setting up the telehealth infrastructure and the human resources can overall help the country itself. So when you're exporting, but that infrastructure is also there for providing domestically. In fact, sometimes it's countries that have developed the domestic infrastructure and which is then leveraged to provide it cross-border. It's not necessarily that the country starts off with an export orientation, unless it's a very small little country which is basically looking at overseas markets, which could be the Singapore case. So that actually can enable you to serve remote and underserved areas of the country and segments of the population which are much more difficult to reach. It can alleviate some of the human resource constraints, because in those areas you don't have enough personnel, but you can do it through telehealth. It can lead to more cost-effective surveillance of diseases. It can provide you with more timely and affordable and better quality diagnostic services. So there are many efficiency gains that can arise from the presence of digital health technologies. And whether it's from exports, but those spillovers can be there to the domestic economy, provided you create those conditions to access them domestically. Mode 2 exports, a very interesting example, and this is true from evidence seen around the world, is that it can incentivize healthcare providers to get internationally accredited. So you have some of these international boards, and you actually, to attract foreign patients and to get reimbursement and tie-ups with medical insurance providers, it will necessitate getting accreditation, so it helps countries raise their standards, can lead to investments in new technologies, new skills and specializations. One of the spin-off benefits, which has been noted in some countries, is about return migration of healthcare professionals, better retention because there are better job opportunities, and more human resource capacity in the healthcare sector as a result, because people see the incentive to go into this kind of training and get better jobs. Mode 4 exports similarly can lead to exchange of skills, knowledge, specialized expertise, development, and so on. On the import side as well, again, the imports can help alleviate capacity and quality constraints. In the case of Mode 1, for some of the countries, for instance, if we look at cross-border telemedicine exports, in some cases it actually helps alleviate the shortage of certain kinds of specialists and care. In the case of Mode 2, again, similarly, you can overcome shortages of physical and human resources. It can ease the burden on health insurance systems, reduce the waiting time. So there's a very interesting study for the US healthcare system which says you could have saved $1.4 billion per year if only 1 in 10 patients were to go abroad for a limited number of 15 highly tradable low-risk treatments. Mode 3 imports, similarly, the inward FDI flows into hospitals or diagnostic centers and so on are not only augmenting your financial resources, there are additional benefits in terms of augmented capacity, upgraded quality, possibly better productivity, and the development of private healthcare establishments can actually help stem some of the brain drain that happens in these countries. So there are many of these kinds of spin-off benefits, not just in pecuniary terms, but also non-pecuniary terms. But there are many potential negatives as well, and these also have been recorded, and I'll give the illustration later. There are possible adverse effects on equity and affordability because these don't necessarily translate to the wider economy or to some parts of the healthcare system. What's the common trade-off that one finds? There's an opportunity cost. You're investing in resources for exports, for instance, but it could be at the expense of certain kinds of treatments and certain segments of the population domestically. So for instance, Mode 1 exports, one of the things that has been cited is that whether these resources which are invested in telemedicine might have been better invested in basic healthcare facilities for immunization or curative facilities. It's possible that the kind of segments that you're serving or the kind of care that you're investing in is not the one that is needed by the larger population. Similarly, in the case of Mode 2 exports, there are records of countries where you have seen more dualism in the healthcare sectors. You have a very expensive, high quality, sort of tertiary care specialized segment which is catering to medical tourists, and then you have the sort of crowding out of the domestic patients to the rest of the healthcare system, which is probably less resourced, less well financed, and doesn't have as much of high-end technologies. You have differential pricing in many of these hospitals, and I remember doing a survey once of Indian hospitals which have medical tourists. They were refusing to give any information on the pricing, but finally I managed, and there's a huge gap between what they're charging the foreign patients versus the domestic ones. And again, it really depends whether these things, these adverse effects happen or not, depend on the initial conditions. They depend on the regulations that you put on some of these establishments. Do you have cross-subsidy sort of policies? How do you spread some of these benefits more widely? Mode 4 exports, again, in the context of GATS, Mode 4 is not permanent, but if you look at the way regulations work, a lot of times the outflows become either they are like rotating migration, they're going from one country to another. They may not be permanent, but they end up technically being permanent. So there is the whole aggravation of brain drain. There is also the high opportunity cost of the subsidies, especially if these medical resource personnel are the ones who've been trained at public expense and then are serving abroad. And these negative equity consequences have to be weighed against all the benefits that I talked about earlier. Again, depends upon what the policies are regarding human resources. How are returning health professionals? I mean, the basic idea is if you want people to return, then you also have to integrate them well back into the domestic health system. How do you actually utilize the skills and upgraded knowledge that they have? So these are also things that the countries that are exporting have to look at if they want to benefit back from these exports. Similarly, on Mode 3 trade, the large public investments in some of the establishments that are set up, even if these are FDI based, there's a lot of public subsidies often that go behind attracting these foreign investors. Is this skewing away from the public health sector? Is it skewing away from some segments of the population? Is the focus then going to be on high-end technologies and treatments? Again, if you look at some of the survey evidence that has been done on health services trade, these are the kinds of adverse things that have been cited by experts as well as what you can glean from the information from the respondents. Yeah, so finally, if we take the example of some country, so I'll give the example of Thailand. There are many regional and other examples. There are countries that have been promoting consciously, and then there are countries which have large domestic markets which automatically are utilizing that also to become exporters. So they illustrate that the channels can work both positively and negatively. So take the case of Thailand, you know that thousands are coming here for medical care. There are certain areas of treatment where the country is very well known. You have accredited hospitals, internationally accredited. And there are gains, some of the studies have cited about the kind of value addition that's generated by medical tourism, the huge foreign exchange receipts, and the improvements that have come in the quality and standards, management practices, etc. So many of the benefits I highlighted earlier are seen in the context of Thailand. But there are studies, these are a little dated. I haven't seen more recent ones, and it would be interesting to see what the latest evidence shows. But these also show that there is definitely the dualism thing that I mentioned earlier, that what is happening is domestic patients were getting crowded out. They were being charged more. The average time that was being spent by the physicians on the foreign tourists was much greater than that for the domestic patients. And basically the foreign medical patients were getting more intensive and costly treatments and basically skewing the resources. And on costs also, what was found, the private hospitals operating in Bangkok were basically focusing on the well-paying foreign segment. There was increased fees for the self-paying patients, and the Thais, as a result, were also having to pay higher fees, and there are some representative increases in these costs, 10 to 25% per year in charges increased by most hospitals, and there were complaints. There were also various media reports regarding this. There is some evidence regarding internal brain drain from the public to the private. Okay, these are earlier studies, so I'm not saying that this is continued, but what is interesting is to say that what the academic literature was saying was kind of borne out in the context of Thailand. And one study cited an additional 100,000 foreign patients seeking medical treatment in the country could lead to an internal brain drain. This is a rural-urban sort of thing. So there's a public-private dimension to the brain drain, and then there's a rural-urban dimension to it, which were aggravated. And the steps that were considered at the time in response were to, of course, focus mainly on augmenting health resource capacity, which is human resources investment, and increasing medical staff training, and linking up between the public and the private sectors, having spin-offs between the public and private. Some policies were also introduced, like forcing compulsory public service, providing financial incentives for rural doctors, etc. So basically, the focus was to augment human resource capacity and address some of the existing conditions which were aggravating this kind of dualism. Now, what are the key takeaways in all of this? That basically health services can facilitate the realization of SDGs, but these are not automatically guaranteed. There are trade-offs, and ultimately it depends on how the resources which are generated are utilized, how they are spread for wider benefit, who is capturing them, is the government doing enough to spread them? And what the role of governments is, it's basically to spread the capacity, quality, and other gains from health services straight to the wider healthcare system. So the point that's important to recognize, it's not trade in health services per se. Yes, it is aggravating some of these problems, but the existing conditions perhaps already had distortions. So, as was mentioned by the ambassador, the domestic capacity, the home clearing, you need to basically get your domestic conditions in place in order to be able to benefit from trade. That is far more important. Trade, in the presence of distortions and bad human resource policies or whatever, if the right conditions are not there, trade can make things worse. What are the two broad directions? One is to focus on the structural issues in the healthcare system, which is on standards, infrastructure. This goes without the trade part of it. You have to do it domestically. The second part is to ensure the synergies between health services trade and the rest of the healthcare system. That is, create more tie-ups, more public-private partnerships, more cross-subsidization opportunities. So basically integrate the healthcare system with other parts of the economy so that those spin-off benefits are greater and you can get those synergies. So, and finally, on multilateral and regional and other approaches, there's a lot of scope actually to bring in, through agreements, cooperation on movement of people, mutual recognition, ethical recruitment practices, etc. I'll stop here. I know I've taken more than my time, but I had a lot of things to convey, and I hope I have been able to. Thank you.
Thank you so much, Rupa. I think you nicely showed the complexity to ensure that trade delivers for health. Let's move on because we're a little bit behind schedule. Let's now look at two countries. First of all, at Japan, and then at the case of Thailand. So Kenji, the floor is yours. Maybe you can share more about Japan and trade and health services. Thank you.
Thank you, Marcius. Two previous speakers talk about relative macro phenomenon from WTO and US viewpoint. I'd like to focus on how Japan is currently navigating global health policies through integrating security, economic growth, and trade. So, because I'm new to this area, and Sweet asked me to join, so just let me self-introduce who I am. So I'm basically a scientist. I was previously professors at University of Tokyo and the King's College. But also, I was a venture partner of venture capital right now. Also, I like lobbying policies So I was an advisor to Foreign Minister and Health Minister when I was in Japan. And also I sometimes even now write policy speeches for them. But also I'm a physician, so I see rich people with very high fees, but also I see poor people for free. And I'm running video artist in training, so that's who I am. So, but I'm going to talk about something which we are going to discuss later, but the existing frameworks, including the UN system, are beginning to collapse substantially for the past 10 years. When I was advisor to Foreign and Health Minister in around 2014, we had a summit in 2016 in Tokyo, Japan, and we had fantastic collaborative atmosphere to rebuild the global health security system and start talking about pandemic vaccine development funding through CEPI. And also with the bank, we tried to create a potential pandemic facility, which is a precursor of the pandemic funding. So this is a picture of who we are. Look at the faces. They're quite, good guys or ladies. Except someone. Yeah, except someone. But don't mention about it. Overall, they are pretty okay. But now, it's like this. So it's quite difficult for us to navigate the global health trend. And the problem about this trade thing, there's a huge protectionism. For example, making everything in India, making stuff in China, not to mention MAGA movement. So, not only vaccine, PPE, and clinical medicines, the government is shifting towards self-reliance and government-driven health initiatives, which will definitely affect not only health and trade, but also the overall global health policies. And then I just want to touch upon the global health in transition, along with this line. But obviously, before doing so, I'd like to briefly explain what Japan has been doing in this area. I think we started the effort, particularly with Asian countries, since 1977, after the Fukuda Doctrine, which focuses on 3 principles. One is peace orientation, no more wars. The second is equal partnership. Japan on top, the other down. No, we are supposed to be equal partnership. Finally, the heart-to-heart friendship. These 3 are major principles of Japanese diplomacy, which I think regained some sort of trust through the years. And also, good thing about Japanese leadership, even Prime Minister and health ministers, they are really committed to global health. And 2 health ministers, recent health minister Takemi and Shiozaki, are obviously good friends of Thai ministers and also Dr. Sweet. And also Japan has been promoting so-called human security. The human security is a kind of, it's not a substitute of national security. It's complementary to national security and focusing on protecting individuals rather than nation state. So we started promoting this idea since 2003. We appointed Madame Ogata and also Amartya Sen as the chair of the committee to come up with the idea of human security. And they focus on 2 things. One is the empowerment and also protection of people, individuals. But given the current threat, human security threat, including COVID, NCD risks, climate change, digital divide, growing sense of inequality, and not to mention about conflict. We cannot just protect individuals. We need solidarity of the community. To combine these three elements, the new UNDP Human Security Report proposed that fundamentally we need trust. How we are going to regain the trust. So the classic global health, we have three major interests. One is national security. Second is economic security. Finally, global collaboration. But after the COVID-19, if you look at the strategies papers across the nation, for example, US is obvious, UK is obvious, Europe to some extent, Germany, France, or other countries, they are shifting more on to national and economic security rather than global cooperation. Japan has been traditionally focusing on global collaboration, but they are also shifting to more on the security, given this current climate. So the focus of our focus, and this will be related to this conference, is that Japan is trying to now integrating economic security with health industry development. So what does it mean? So here are the recent Japanese initiatives, starting from Health and Medical Strategy in 2014, and we developed Asia and Africa Health and Wellbeing Initiatives and Global Health Strategies, and we are now discussing about the third round and Health and Medical Strategy. All of these are primarily targeting industry rather than WHO or the UN. The Global Health Strategies has more influence on the UN system, but these strategies, government-led initiatives, are more focusing on private sector. But the more we dig into this, the more we are understanding that to harness the industry and to promote national economic security, we need both. So recently, the case of Takemi, who is a good friend of Dr. Sweet, proposed global health vision by himself, and so they laid out some of the action items. So in terms of global collaboration, they announced to establish the UHC Knowledge Hub focusing on financing, which will be located in Tokyo in collaboration with WHO and the bank, and also policy engagement with G7, G20, focus primarily on health sector, finance sector dialogue. In terms of national security matter, we promote more on the infectious disease control collaboration. And economic security, we like to open up more on the ecosystem development and supply chain management in terms of vaccine and pharmaceuticals. But also, the final item on the Indo-Pacific strategy includes expanding healthcare services, medical tourism, and training for foreign professionals. According to GATT modality classification, I don't know, these includes mode 1, 2, or 3, maybe everything. But potentially, previously, Japanese Ministry of Health will not talk about that kind of industry development process. But it's quite new, and it's quite updated from their viewpoint. And I'm currently heading the agency called Medical Excellence Japan, which was established in 2013 by Prime Minister then Shinzo Abe to promote the international expansion in healthcare. And it is not under Ministry of Health, it is under Ministry of Trade. And it functions as a public-private partnership platform connecting the government, medical industry, and academic institutions. And we initially focused on mode 3, exporting hospitals, which failed, obviously. You can't just export hospitals without knowing the system, regulation, and the people. It all failed. Not all, but mostly failed. So we shifted toward to integrated and sustainable platform approach. What does it mean? It came from this idea. This man told me 10 years ago, Kenji, you need 3 items to move the mountain. So you need the knowledge, you need the politics, you need society. So I think that's the basis of National Health Assembly of Thailand. We copy and pasted this idea to create medical excellence Japan system. So we promoting, MEJ consists of government, industry, medical community, and academic institutions. And we try to copy and paste to other countries to promote Japanese product. And we have just established Medical Excellence Thailand in collaboration with the MOPH Health Service Department and Thai FDA and the Chamber of Commerce people. It will all run by Thai people. We will just collaborate. But we will do inbound project by using this kind of entity because medical committee is quite secluded. So unless you have a multi-stakeholder approach, we cannot do this kind of effective job. So, sorry. This is how we work. So we create something like MEJ or National Health Assembly type of stuff, building upon Sweet's idea in other countries. So we recently established Medical Excellence Thailand and Medical Excellence Vietnam, and we are now building Medical Excellence India and Indonesia, and we are moving to Africa next. The reason why we create this platform is that, again, just exporting hospital will not work. We need multi-stakeholder, and I don't care about mode 1, 2, 3, 4. All are interrelated. So we really need sustainable, trust-based collaboration, particularly in health sector. Given this nation-to-nation, the classic UN type of collaboration will no longer work well. We really need, some sort of like-minded, platform-based collaboration on the ground will be more productive. So I will stop here, but in conclusion, Japan has traditionally emphasized human security and trust building after the World War II in its global health policy, particularly in ASEAN countries. But we have also added the element of industry development process, and the focus now shift to converting these policies into actionable industry strategies by integrating domestic and global health policy with economic security. And we are in the process of developing health and medical strategies, which will be published in 2025, with spotlight key issues for industry growth and economic security more explicitly. So we are in the process of doing it. So thank you very much.
Thank you very much, Kenji, for sharing the latest on Japan's approach to global health. Very insightful. Let's move to Suchaya to tell us a bit more about how the Thai government approaches the trade negotiations when it comes to health services. The floor is yours.
So thank you so much, and good afternoon, everyone. First of all, I'd like to thank you for having me here to share our views on Thailand's position regarding the health services. I will touch a bit upon the FTA's negotiations and the overview of Thailand's policy that involves the health services, including the medical hub and medical tourism. Allow me to briefly introduce about the role of the Department of Trade negotiations. We play a crucial role in the negotiations of international trade agreement, including the free trade agreements, because it's a government policy that the FTA can be served as a tool to help Thai business to expand their export for goods and services, and also in the same time we try to attract the investment, good quality investment from the countries that have potential in terms of the advanced technology and new innovation. So when it comes to the FTAs that Thailand has concluded so far, we have like 15 FTAs covering 19 trading partners. The latest one is the one that we do with Sri Lanka bilaterally. We already signed the agreement, and I think it's going to be enforced very soon. Under the FTA that Thailand has concluded that it's a comprehensive one that covers like issues such as the trade in goods, trade in services, investment, rules of origin, economic cooperation issues that is included in the FTA. But for the trade and services, like you already known before that under the WTO Services Sectoral Classification List, or the W220, we classify the list of services sectors, and health-related and social services is one of them. And under that, it's also be categorized into 4 subsectors: the hospital services, other human health services, social services, and other. And also under the business services, we also have the professional services that include like the medical and dental services, and also services provided by nurse. So this is the overall of the WTO health services. Under the FTA negotiations, when it comes to trade and services, it will comprise in 2 parts. The first one is the text chapter, the rules and obligations regarding the trade and services. And the second part is the commitments that we have with our trading partners. For Thailand commitment, and also if you see from the PowerPoint, I think it's made from Dr. Rupert, you see that the health service sector is very limited when it comes to the commitment that the WTO member has committed so far. And even under the FTA, we see that, including Thailand, we see that the committed in the health sector is very limited. The right column is some of the examples that we have commit under the FTA, but just in some of the FTAs, for example, under the ASEAN and the RCEP, you see that we have like a limited subsectors that we offer for our trading partners to allow the service supplier from other trading partners to come to invest in Thailand. So I would like to touch a bit upon our policies that involve the health services. The first one is about the national strategy from 2018 to 2037. Is the main policy that try to bring Thailand's is the policy that we have to pursue for Thailand to become a developed country with security, prosperity, and sustainability. And there are 6 key indicators under the national strategies. One of them is the enhancement of competitiveness. And the guidelines in that one is to develop futures industries and services in order to help Thailand to become developed countries, and with technologies and innovations. And one of the industry is the integrated medical industry and services. So when it comes to the Thailand 4.0 policies, it's about the try to make Thailand as innovation and technology-based value economy. And it's the targeted industry under the Thailand 4.0, it's comprised of 12 target industry. And one of them is about the medical and wellness tourism, and the other one is about the medical hub. And when it's come to the medical hub, this is the medical hub strategic plans of Thailand. Since 2004, the Ministry of Public Health has been assigned as a main organization to administer the strategic plans for Thailand to be the medical hub. The first strategic plan is try to promote Thailand as the Center of Excellent Health Care of Asia. The second one is to promote Thailand as a world-class healthcare provider. And the third one, the current one, is to promote Thailand as an international medical hub. They'll have like 7 key development strategies and focus into the 4 outputs for us to be a medical service hub, wellness hub, academic hubs, and also the product hub. And currently, the Ministry of Public Health has recently announced that they will issue the next strategic plan for 10-year period from 2025 to 2034. And currently, the Department of Health Service Support, together with relevant agencies, is now working on the draft strategic plans to put the Thai as the world's leading international health and comprehensive medical industry hub. They are now working on the draft strategic plan. And when it comes to medical tourism, I think as you may know, that Thailand is a very popular and very well known for the tourist attraction, and Thailand is one of the tourist destination. So when the tourists together with the medical care, it can go together. When people around the world come to a country to have like medical care, maybe they will bring their own families, their friends, and when they come to a country like Thailand, they also look for a place to stay, to take a vacation after that. So according to the medical tourism index, the medical tourism index in 2020 to 2021, Thailand has ranked top 5 out of 46 countries based on destination attractiveness and medical tourism cost factors. So I think this is the results on how we promote the medical tourism. And according to the LH Bank, the LH Business Research, this is the medical tourism market value. So you see the trend that it's on the upward trend since the 2019, after the pandemic of the COVID-19, the 3 years, 2020 to 2022, the value has dropped significantly, and it will recover soon in last year, and also continue to grow this year as well. So because of the the demand that still have from the tourists from the CLMV, the Middle East and China. And so overall, I think when you talk about the health services, it involves many stakeholders. If you look at the supply chain of the health services, it can start from the pharmaceutical industry, the medical device industry. So I think to support the government policies. I think the relevant government agencies can do their part. Like for example, for the Department of Trade Negotiations, we can also take the policies and put into place. Under the FTA negotiations, we try to maybe make a commitment if we can in order to attract some of the investment that we still in needed, or to try to persuade, try to request our trading partners to open up the market for us in the sectors that we have potential. And also, like I mentioned, that maybe when it comes to health services, it's quite sensitive. If we cannot open up the market under the FTA, we also have another mechanisms under the FTA. For example, nowadays, if you look at the recent FTA, you see that other than the commitments for trade and services, we do also have like the annex. For example, we have the annex for the tourism, for the health services. So to make like, to try to enhance economic cooperation between Thailand and our trading partners. So I think that that's the way that we can do to support the policies when it comes to health services. But also nowadays with the digital transformation and all the technology that we have, we also have to look for the technology issues that can help with the improvement of the health services, including all the providers, all the IT infrastructure, and also the personnel and human resources. So with all these efforts and these policies that in place, so I think we can come towards the aim for the sustainable development in the future. So thank you.
Thank you very much. Good to see how Thailand wants to become this medical hub. I know that we are late. We also started a bit late after lunch, so maybe let's see whether there are any questions from the floor, and then we wrap up in 3 to 5 minutes. Please, yes.
My name is Kanika Kitiwechakun. I would like to ask our Thai speaker from the Department of Trade Negotiation, because as the speaker from UNESCAP already said that medical hub has two impact, positive impact and negative impact. In Thailand, yes, of course, the the Thailand strategy that produced by the military government said that we need to enhance our economic. But National Health Assembly, that Dr. Koji said that is the role model of in Japan model. So that one also suggests that medical hub shouldn't undermine our Thai health service. Particularly, if you want to promote the medical hub, it should be only wellness, not treatment, because treatment is cause a lot of brain drain in health sector. How can the negotiator, how can negotiator like trade negotiator try to talking with other sector, try to litigate the negative impact from this trade negotiator, trade in services? Thank you.
Excellent question, Suchaya.
So thank you so much for the question. I understand that when it comes to the medical hub policies that we currently have under the Ministry of Public Health, I think they focus on the four outputs: the product hub, the medical service hub, the academic hub, and also the wellness hub. So this is the policy that we have in place. But when it comes to the FTA negotiations under the trade and services, I think Of course, the health services cover like as I mentioned before, the hospital services, the social services, and also the medical services, and also the professional when it comes to the more for the people that will move around to work in a country. The negative impact because of the FTA negotiations when it comes to the services. Normally in our past FTAs and in the FTAs that we under negotiating currently, the commitment that we have under the FTA on the health services is the commitment that we have. We look at the overall picture, the balance of the benefits and the negative impact that might have. And in the negotiation process, we have to conduct like stakeholders consultations that involve many sectors related to the health services. So I mean, when it comes to the health services, you see that we have like a very limited commitment under the FTA because of the health services has an impact on the well-being of the people. So, I mean, if it's for services, it's what can I say? I don't think it will have like a negative impact. It focus on the trade and services, but of course on the products, it's maybe the different things. So what I try to say is that for trade and services, the commitment that we have, it's not go beyond what the laws and regulations that we clearly enforce in the country. So I don't know whether I answer your question or not.
Thank you very much. I think, okay, one last question. Please keep it short. Thank you.
Yeah, I think these questions go to the Bupa Chanda, because right now in Bangkok particularly, we have lots of the private hospital that provide the service for the foreigner, like tourism, the health, something like that. As you mentioned, they have the two sides of one coin, pro and con about this one. I would like to hear your comment how to mitigate, how to prevent, the problems going to come with, the health tourism, something like that, to prevent like the brain drain from the state hospital to the private hospital as well, and how to not to competition between these two parts. I would like to hear your comment. Thank you.
Okay. Yeah, so first of all, I want to say one thing, which is I'm not saying that there should be commitments on health services. It's a question of what sort of riders and things you put in there. So this relates to your question. See, it's not just about what you do in a commitment, but it's what you do in terms of the domestic policy. That has to precede anything that goes into negotiations. So there are many ways of addressing this. I think first, the most important thing is actually human resource investment. That is a generalized thing. So if you have sufficient resources, you're not going to get the pull and push between the public and the private which is catering to foreign. So those dualism issues arise because of under-resourcing, inadequate supply of resources, etc. So that's the second thing. Is you can, even within the private sector, create incentive mechanisms in such a way that you can have requirements. It may not always work, it's a question of enforcement, where you have some sort of cross-subsidization requirements, especially if those hospitals and so on have been set with some sort of incentives, etc., that you have them catering to the lower income groups, or set off some sort of conditions on them so that the benefits are also coming to the other strata of society. Now you could say that this interferes with the way the business model might be, and it's not good to put too many conditions, but some countries have done this, especially if you've been given some sort of subsidized land or any other facilities or tax benefits, etc. This is one thing. Another could be in terms of some sort of pooling, in terms of collaboration on technology or training, or so basically some of the things that are there in the private sector are also benefiting back the public healthcare. So this is the question of the synergies and partnerships and tie-ups and so on. The fourth thing I would say is a problem that exists within the public healthcare system in many countries, which is the way they manage their human resources. I mean, so it's not just about augmenting the quality, it's about also retaining the people better. So that kind of work or investment also has to be done. So it's a combination of things really. So the question is not to say no trade, no this, but trade can worsen if you don't have many of these things in place. So these are my answers.
Okay, well, I need to organize. Ambassador. Okay, so let me just conclude by saying, I think trade and health services is becoming increasingly important, and we need the right policies to make sure that trade and health services delivers for public health. Let's give a big round of applause to all the panelists, and thanks a lot for your attention.
Thank you very much, the panelists and the moderator, Matthias Helbel, for moderating this session. Before we begin the last session of today, the session 4, Geopolitics and Implications for International Trade and Health, the US election, we will proceed with a short 15 minutes break. Just a quick reminder before moving on to the coffee break, for the speakers who haven't yet submitted the boarding pass to the Secretariat team, please stop by the registration desk and give them your boarding pass. Thank you very much, and see you in the next 15 minutes. Thank you.